Nursing burnout is prevalent today in no small part due to the fact that nurses are sleep deprived. The average 12-hour shift worker gets only 5 hours of sleep a night. Yet science has proven that the human body requires 7 to 8 hours of sleep in a 24-hour period. But only 35% of Americans get that. The National Sleep Foundation estimates 2 out of 3 people are sleep deprived. 7 out of 10 say they experience frequent sleep problems. Are you among them? There seems to be sort of a cutoff point, where if you get at least 7 hours, your body and brain will function at their best. Evidence shows that chronic sleeplessness of less than 6 hours a night can increase heart problems by 48%. If you are getting less than 7 hours of sleep, you also have an increased risk of obesity, diabetes, stroke, high blood pressure, and a shorter lifespan. Worse yet, it increases your fatty deposits. Now I've got your attention. Not getting enough sleep actually hurts the way our cells use the insulin our bodies make. One study of more than 1,000 patients found that overweight people sleep less than lean ones. When we sleep, a hormone called leptin rises in our systems. Leptin controls our appetites. The higher our leptin levels, the less hungry we are. Poor sleep seems to interrupt the leptin's rise, so those who don't get enough sleep and tend to be hungrier. Have you noticed that when you're overtired, you feel more hungry? I still remember getting off 11 to 7 shifts feeling starved until I got some sleep. Sleep studies show that we experience 2 intervals of increased sleepiness and low performance in a 24-hour period. One is from midnight to 6 a.m. and the other occurs mid-afternoon around 2 to 4 p.m. That explains why my head is nodding at the computer at that time of the day. Maybe we should do what other societies throughout the world do and take an afternoon rest at nap time. Even 15 to 20 minutes helps. Studies show our bodies are really geared to do that, but we just ignore it. Nearly 50% of men and women in America say they would go to bed earlier if they didn't have TV or internet access. These technologies provide a perfect opportunity for you to use some good decision-making skills and practice good sleep hygiene. Here are some suggestions for better sleep. Go to bed at the same time and rise at the same time each day. Make sure the bedroom is quiet, dark, and relaxing at a comfortable temperature. Create a relaxing bedtime ritual, reading or listening to music, for example. Make sure you have a comfortable mattress and sheets. Use the bed only for sleeping and making love. Exercise regularly and maintain a healthy diet. Avoid exposure to bright light prior to bedtime, especially from electronic devices with the blue light. Don't eat for 2 hours before bed. Avoid alcohol and caffeine. Alcohol can put you to sleep, but then it wakes you up in a few hours. Utilize the stress management techniques I've taught you. Allow no pets in your bed to lick your face or take your space. If you don't fall asleep after about 20 minutes, get out of bed and do something relaxing before trying again. Avoid napping, especially in the late afternoon. Exercise regularly, but not before sleep time. Avoid screen time for at least 1 hour before bed, especially those electronic devices. For a safer, healthier life, says the National Sleep Foundation, get a good night's sleep and learn to enjoy a guilt-free siesta when you can. That's hard to do at most jobs. In kindergarten, our teacher made us lay down or put our heads on our desks just for a rest for a while every afternoon. I think maybe Mrs. Geltz had something there. Are you getting the required 7 to 8 hours of sleep in a 24-hour period? If not, what would you change to do so, to practice your self-care? I've dedicated my life's work to reducing nursing burnout that's become the epidemic in our beloved field. Please visit selfcareforhealthcare.com to learn more about how we can help caregivers to set up a call with you and me to discuss your organization. I look forward to connecting with you soon. Take care.